So I'm glad to be here today. I started in school nursing in DuPage County around 1992, and it was probably around a couple years after that, 93, 94, 95, that doing our routine head lice checks that we used to do. One of the parents that I found head lice, she said, this really is a non-issue. If you're going to be spending your time trying to find things, why don't you start culturing people for strep throat? And wow, she was ahead of her time because this is probably like 20 years ago. And I thought about it, and I said at the time, says, well, she's right. I mean, it's a serious issue. It can cause, the rheumatology and the cardiac conditions and stuff. But I never, at that time, had thought that it caused the symptoms that we've been learning about today. So it's really good to know that now that we're not, we still can't do strep tests in school. We're not clinics, not licensed for laboratories, but we have certainly ratcheted down the head lice checks. And if you're in a school, you probably don't like ratcheting down head lice checks, but that's where we are. But one of the things that we can do, today I want to talk about a little bit of the role of the school nurse, is one of the things that we do and can do, continuing, is to communicate signs of illnesses and to educate parents, whatever it might be. Uh, uh, and speaking again of head lice, I'm going to start scratching my head, but speaking again of head lice, the nurse today just had emailed me this morning, and she had said, I know that we don't exclude anymore for the presence of head lice, but what can I do? Can I still check heads of symptomatic kids? Can I still tell parents about it? And I wrote back, of course you can. You can still check heads of symptomatic kids, just like you would, check the temperature of a symptomatic kid with a fever or a flushed face or a stomach ache or things like that. You certainly can educate parents about treatment and symptoms. You certainly can refer them to their primary care provider for additional advice. All the same kind of things we would do if a kid was complaining of a sore throat or other symptoms of any other viral or bacterial disease or condition. So again, the role of the school nurse is a lot of times to sort of identify those early signs and symptoms of something that's going on in that student or in the whole population of the school. And to educate the parents and then to have them consult with their physicians. It's also something too, we keep up with these things too. We're here today not because either of our children has these symptoms and hopefully won't. I have a new 2-month-old grandbaby and I'm going to be watching for those symptoms, that's for sure. The things we can do in the school to communicate illness. Teresa had said a lot of the parents, and she's going to mention this too, want to know when there's anything going around, the very least little thing. Well, we don't send out a lot of notices to parents because, if you're a parent, you've collected those notices. There's somebody around with pink eye. There's somebody around with chicken pox. There's somebody around with somebody went home with flu. There's somebody. We try to educate them at the beginning of the year. These are the common signs and symptoms you might find. However, one of the nurses that said, "Oh, I don't send notes home for anything anymore, not even strep." And we're like, "Well, you might want to back up on that because strep can be something that has significant sequelae, and it might be a good idea." But what we do is, like, if parents come to us and say, "My kid is susceptible to anything that's going around. If you know of anything in the classroom, or if there's more than a couple of kids in the building with a certain signs and symptoms, would you please let us know so we can start really looking out for these?" I know the parents that I saw in the video are hypersensitive for all those symptoms, but some parents are not there yet, so we should educate them when something is going around on a routine basis if we can. We also report illnesses. Some illnesses are required to be reported to the state of Illinois, the state health department, and one of them, they're required to report it either immediately, which means within 3 hours, which means as soon as you know it, and then or within 24 hours. Others are longer and have up to 7 days to report it. Well, the reporting is on any healthcare provider that knows or suspects the condition. And most of the time, we wait until the parent comes back and says, "Oh, they had chicken pox or mono or whatever it might be." And we have a list of those that are required to be reported to the state. A lot of those are not required to be reported. So the one regarding strep that is required to be reported is the Group A, and I want to make sure I get mine right here. I wrote it down. Within 24 hours, report to the state or local health department. Group A, Group A Streptococcus invasive, including STSS, and I'm sorry I didn't look up STSS. One of the doctors here can tell us. STSS and necrotizing fasciitis. Remember that flesh-eating disease? Okay, that's what they were talking about there. But again, the nurse might get a note from might see on the absence list, these kids are absent, sick, sick, sick. injury, funeral, sick. We don't know exactly what sick means. So then when they're home a few days and then they come back, you might hear from the kid, oh yeah, I had strep throat. Well, then that's not 24 hours anymore. So it puts a burden on the school nurse to try to report these things. Plus, we don't know which was A or B. So really, it's the healthcare providers. So we need to encourage more of the healthcare providers to do that first reporting. And we find out from the state health department that oftentimes they don't hear it from the healthcare providers. They hear it first from the nurse, and then they back up trying to find out from the doctor, was this test done, was that test done, and all that stuff until they can get to confirm it, and then they do follow up in the school or in the community. And by that time, it may have gone viral, or rather bacterial in this case. So we do like to do those things, communicating illness and reporting those things back to parents. So in some cases, a child may be absent for a while, and the doctor may tell the parents, your kid's pretty sick. We're going to have to do a 10-day course or whatever it might be of this. In the meantime, the symptoms, particularly about this, the PANDAS or PANS, it's going to take a while. And in the meantime, then it might be a good idea to have the school provide homebound education for the student while they're recovering from this illness. So what's required there for the school to be obligated really to provide that is a medical certification form, and that has to come from the healthcare provider, and the healthcare provider is an MD or a DO, doctor of osteopathy, or a nurse practitioner. I was glad to see the nurse practitioner there from California in a lead over there, or physician assistant. It used to be only the MD, and we had it changed as licensing laws got a little bit more expansive for those other categories. Anyway, so they fill it out and they say, what the condition is, about how long they think this child might be out. The qualifying is that the physician or the provider expects that they'll be out for 10 days or more this school year. Okay, they don't have to be concurrent. All right, that's a hang up in some schools. They go like, well, on the 11th day we'll start this. No, they begin as soon as they get that form, and within 5 days really, if they need to find the tutor to go to the home and stuff like that. So it begins when they get that form, as long as it's properly filled out. It also says we expect 10 days this school year, of which 2 or more will be back-to-back. And some schools are saying, well, when they're 2 together, we'll do that. No, the physician is expecting it. It's just like when they do a hospice referral. We expect this patient to die within 6 months. But if the patient doesn't die in 6 months, they can still get hospice. They begin on the day that is done, and that was probably bad analogy here, I'm sorry. But the doctor is just saying this is a condition that we expect might have 10 days or more absence this year, and probably 2 or more will be back-to-back. But neither of those conditions has to begin before the tutoring begins. Okay, I want to make that clear. We do have our FAQ on our website and also the medical certification form on our website. Sometimes the child's disability is interfering, and in this case it's a disabling condition, and needs some accommodations at school. So let's say they've gotten over the worst of it, but they still might need some time to sort of debrief, calm down, transitions, whatever other kinds of accommodations that might be necessary for them. Now, if they're still keeping up academically and it's not interfering with their academics, which I've learned it probably is because it's so disabling, there's a Section 504. Anybody, are you familiar with what that means? Okay. So Section 504 doesn't mean they're going to change the curriculum. Now, what they might do is instead of 20 spelling words, they might do 10 if it's just a matter of repetition. They've mastered the material. They don't need to keep on practicing that same material. They could do that to reduce the amount of time for homework or testing or things like that. Okay, so that the team at the school gets together and decides what the accommodations might be. Then if the situation is that they really are suffering academically, and in many of those that was very clear, then the team would convene for special education services. They'd have to do a full and fair evaluation across several domains, which includes the social developmental, also the health, the psychological, and in some kids it may be an issue of language, English language learners and all that, but in particular for the ones we're talking about today, social developmental, what's happened, have they regressed, have they lost friends over this, what's happening, the depression and suicidal behavior or ideation was just, chilling like the doctor said. And then also the nurse would be doing a full health evaluation. And, in something like this, sometimes the team will say, well, this is a psychological issue, or this is an emotional disorder. The nurse doesn't need to be involved because it's not a medical issue. Well, nurses are well versed, like you are too, in the psychiatric issues. I mean, the brain's still connected to the body, last I heard. So it's still something that a medical person would need to evaluate. And I hope the more that we disseminate this issue, more nurses will look at that. I worry. The other day, one of the nurses, and I take calls and emails from nurses all over the state, and one said, I've been asked to do a wellness check on this kid that's in isolation frequently. And she says, what does that entail? How often should I be doing it? And things like that. Well, I gave her what my opinion was of what it would entail. But then today I'm thinking, wait a minute, what if that kid is undiagnosed PANDAS? I'm starting to get really worried and going back through my emails to say like, hey, possibly look at that. So looking at all those conditions and trying to uncover any stones that might have not been unturned by the providers. As we found out, many medical care providers might either not know enough about it or poo-poo what they do know about it. So the nurse that has training on PANDAS can explain that condition to the staff at the team meeting. Just like, we're sitting here learning, then they'll be sitting there learning too. And in some cases, it might even be more information for the parents that they may not have gotten. But other team members need to know about what's going on too. The bus drivers, the librarian, the lunchroom people, and the playground recess people. So nurses provide the guidance to the team either on 504s or IEP, and just in summary, they provide guidance to the team, they provide guidance to the parents, they increase notification and try to communicate illnesses and treatments. I'm going to turn it over to Teresa. Thanks, Teresa.
Okay, so one of the things that we want to make sure that we're, as a school team, doing is supporting our parents that are in this situation. We want to make sure that we're accepting all of their emotions as valid emotions. Parents are going to be angry, frustrated, disappointed, sad, relieved. Parents are going to have all kinds of emotions at different times, and we want to make sure that we're respecting that and being sympathetic to all of their emotions and providing the support, and also to the children. Some children are old enough to understand what's going on, some aren't, and they're going to have emotions about it too. And again, we just need to validate those emotions and support them as best we can. In supporting them, we want to make sure that we're educated in what resources are available for support. So the PANDAS Network, and there's plenty of other resources out there, online resources, in-person resources, and making sure that you know what's available in your community so that you can pass that information on to families. Providing the anticipatory guidance is huge. Parents don't know what they don't know. They don't know if they can get that homebound service. They don't know maybe what a 504 and IEP process looks like. They may need to be walked through the steps. So that's our job. That's our job as the team, the school team, is to provide those. What do we do? Being patient with parents. Parents are getting information from everywhere. Their doctors, their insurance company, online. They're doing their own research. They're trying to figure out what's going on at home. We just need to be patient with them, maybe even help them kind of decipher some of the information they're getting. And remembering the levels of stress. The video was a great clip. I meant to mention in this that parents are experiencing financial stress. They're experiencing emotional stress. They're embarrassed sometimes to try to explain this to the kid down the street why Joey can't come to the birthday party. There's lots of stress. They're maybe getting stress from other siblings in the family because the other siblings are jealous. Mom and dad are spending so much time with, the sick kid. What about me? So they're getting a lot of stress from school. School wants to know, why is your kid not in school? They're hammering down with truancy officers. Your kid needs to be in school. We're trying, but so parents are really stressed, and just being patient and kind and helping them walk through these steps is going to make a big difference as the school team. Okay. And then your team may be asked to collect data. You may already be collecting data, but parents may need data on things, especially going back to their physicians and so forth. They may need data showing what types of behaviors the school is seeing, when are they seeing, what's the frequency, what are we doing as a school to help reduce some of those stressors, what works, what doesn't. If you're not collecting data for parents, it's not a bad idea to start, to have your social worker set up some ideas for managing some of those calming strategies and what's working and what's not. Your school psychologist can help set up some data collection within the classroom when the child's out at recess, when they're at lunch. So just making sure that we're helping parents try to decipher what this child's day looks like at school. We want to make sure their environment is safe. Some of these kids are going to have balance issues, vision issues. So we want to and violence. Some of their behaviors can be violent and aggressive. We need to make sure that they are safe in their school and that they're not going to be harmed any further than necessary from their reactions. And then help the team establish realistic expectations for this child at this time. Every flare might be different. They may have, trouble getting on the school bus. That may be the best thing that they can do today is just get on the school bus. They may have trouble getting through the day without crying 3 times. So we need to set expectations that are appropriate for each flare, and they're going to change. They're going to be different. And then, of course, reinforcing good hand hygiene throughout the school environment is real important for that child, but for all children, to reduce the risk of infection and passing around any other germs. Remembering that these students have decreased coping skills. These kids they're not going to be able necessarily to explain to you how they're feeling. They're not going to be able to have some flexibility in thinking of what's going on in their day. And you have to consider how this is going to affect their day academically and social emotionally. If they're not able to say, I'm in pain or I'm uncomfortable or something's going on, the other kids in the class may not understand that. Now this child is now isolated and not being allowed to participate with their peers. Individualized health plans. Everybody familiar with an IHP? Okay, so we want to make sure, the important part of this is that we want to make sure we're considering the student's entire day. So bus transportation, like Jessica said, we do need to share with the bus drivers a little bit. If this child is having auditory sensitivities, do they need noise-canceling headphones on the bus? Do they need to be on a separate bus? Do we need to figure out what's the best way to get this kid to school? PE, maybe there's some modifications that can be made in PE, or maybe this child needs an exemption from PE for a period of time. Field trips, lunch and recess. Recess is the quietest part of the day, right? Lunchroom is like silent. So some of these kids might be having difficulties at lunch, but that doesn't mean that they shouldn't be allowed to have lunch. Maybe they can have lunch in a separate room with a couple of peers and a supervisor, So just trying to come up with creative ways that these kids can still participate in their school day, but what is safe and effective for them. We want to make sure that we're on top of the medications, and this is a parent piece. Parents really need to be encouraged to communicate with us frequently. Medications are going to change. Symptoms for the medications are going to change. We need to have orders for any medication changes, and we need to make sure that parents know that. I really want to help your child, but if I don't have a new order for that new medication, I can't give your child that new medication. That's legal. So we need to make sure that parents are really communicating those pieces with us and providing that information as needed. And we want to get to know these students. Each individual student is going to look different. And again, when their expressive language is not able to tell us what's going on with them, we need to know. We need to know that, ooh, this is different than I saw last week. Make yourself aware and familiar with these kids. Make sure that you know what they look like. What calming strategies work for them? Maybe there's something that worked for them last week that doesn't work now, or vice versa. So just making sure that you're getting to know these kids and communicating with the parents things that we're observing at school. The New England PANDAS Association has a really nice template on their website for an IHP. So they list all kinds of goals, they list all kinds of considerations and interventions for staff, for nursing, for administrators. So I encourage you to go and check that website out if you're looking for some information on the IHP. They have a lot of information on there. Some of the things that we do need to consider on their IHP is the dietary restrictions. If a child can't suddenly eat a particular food, we need to provide an alternative. Parents may be asked to provide an alternative, but particularly with kids with free and reduced lunch, we're obligated to provide them an alternative lunch. There is the disability-related substitution form that can be filled out by a physician so that the school has to provide them an alternative lunch, something that's appropriate. that site, I think that's available. Is that on the ISB website? Yes. Okay. Frequent breaks, making sure that these kids have the opportunity to take frequent breaks. And if they can't tell you they need a break, they should have a staff member that recognizes they need a break and give them that break. It might just be a walk down the hallway. It might be, I need to go to the nurse's office. It might be, I can sit in the back of the room for 5 minutes. It just depends on where that child is on that particular day. And have that system in place for staff to be able to communicate back and forth to each other that they're recognizing that this child needs a break, we're going to step out. Infection control is a big part of a nurse's day. Reinforcing and practicing the hand washing protocol, making sure that teachers are teaching that in their classroom by example, making sure that there's signs in the bathrooms and at the lunchroom doors. And it might even be that at the beginning of the school year, you know, the nurse or other health teacher in the school provides some actual lessons on hand washing. There's hand washing curriculums out there. And again, that's really just good for students everywhere. And then the frequent communication with parents is also really important. And a lot of times this does fall onto the nurse or the social worker, is this communication piece. Making sure that there is a way that parents are comfortable communicating back and forth things about a child's day. Some parents resort to a notebook that they put in the child's backpack that says, oh, you know, Jimmy had a great night last night, or, you know, he didn't, and then the teacher can communicate things back and forth as well. Parents can request, you know, we've noticed this behavior starting. Can your team please help us see if you can collect data on that? So making sure that you have a good way to communicate with parents. The question about notification of illnesses, the PANDAS Network actually has a sample letter on their site that is exactly that. It's kind of designed to go out to the entire school and say that we have a student in our school who is susceptible to particular illnesses, and we appreciate when you're calling your child in sick to please be specific. What's going on? What are they sick with? You know, and I would encourage you, if you are going to be using a letter like this, make sure that you've approved it with your district as far as some of the wording. Again, it's a sample letter, so it may need to be tweaked a little bit with whatever your legal professionals tell you. And then we always want to make sure that these children have a safe, available space to rest. It might be in the nurse's office. It might be a social worker's office. If your school has a sensory room that the child can go to, they need a place where they can go and know that they are going to be able to have some kids, especially at different ages, if they're having tics, it's embarrassing, and they don't want to be doing it in front of the other students, especially if they're having a bad day. So providing a space where they can go and get some relief and have their episode, have their moments, and when they feel a little bit better, they can go back. Or maybe not, depends on their day. And we also want to make sure that we're always being on top of those orders, any changes in treatments. We're aware of any changes in treatments, particularly if they're going to affect the child's attendance at school, that anticipatory guidance. Ice packs can be helpful, even if it's not necessarily going to fix the headache, but it just might make them feel better that you're trying to do something. You know, they know, these kids know that you're trying to help them. And making sure that you have sensory equipment available for them. Bouncy chairs, weighted blankets, fidgets, all kinds of different things that they can try, because again, each flare might look different and they may need different sensory things at different times.